Okay, we are back with Chris with Ultra Life Peptides, and this is going to be our second podcast together because we have so much to talk about. Because the first one we could have just probably kept going on and on for hours and hours, but here we are again, and there's always something new when it comes to peptides. So, welcome. If you want to do a little introduction again and talk about Ultra Life Peptides, and then we'll get into it all.
Yeah, sure. So my name is Chris Bradley. I am the owner operator at Ultra Life Peptides. Um, my background is I am actually an architect and landscape architect by schooling, by undergrad and graduate degree.
Oh, I'm an engineer.
Yeah, so I haven't been really doing that for about 15 years now. I've been working in, formulating nootropics and adaptogens and products for other companies, as well as my other company, Ultra Life Sport, which is our supplement company, our supplement brand. We also own a supplement manufacturing company as well as part of that, which we actually formulate and make supplements for a lot of other brands. And I started using peptides about 7, 8 years ago and healed so many different things in my own body, in my own life using peptides. And as my really good friend who owns labs all across the country was working on this new drug delivery system called the Protix Ion system, that's a patented system for drug delivery intranasally and oral mucosally. We started talking about peptides, and they started doing a lot of study on peptides in the lab and realizing that this new Protix Ion drug delivery system works amazing for peptides. So it works on hydrophilic and lipophilic compounds both, and which some peptides are hydrophilic, some are lipophilic. So we started talking about 3, 4 years ago about incorporating peptides into Ultra Life Sport into our supplement company. And over the years, it developed as they were releasing the Protix Ion technology. They built up a peptide lab where we actually synthesize the peptides right here in the US from the raw aminos. We don't bring in any Chinese API and just bottle it here in America and lyophilize it and call it like an American-made product. So we're really proud that we're offering a completely 100% American-made product from the, synthesized from the raw amino acids
Yeah.
right
I
here in California.
I know. I don't know if you're on Instagram, but it's like the reel just went viral with people saying, you don't need to do this with peptides. It doesn't matter. They're stable. You don't need to refrigerate them. You don't need to do anything. I don't know. There was just so much conflict. And I'm curious if you've heard of this study it was Janoshek.
Janoshek, uh-huh. Yeah.
Okay. Because they were saying that it can stay, like, it doesn't degrade. You don't need to, when you reconstitute it, you don't need to be careful. You can shake it. You can do all these things. They were saying, like, and I'm like, so everyone who's been refrigerating it forever, that we don't need to do that. Like, everyone was arguing that it doesn't degrade when it comes, these raw peptides from China to the US.
So yes and no. Pre-lyophilization. So what they're talking about at Janoshek, and they're correct in this, that and Jay he's a great expert on this stuff. They've been working with peptides and SARMs and HARMs and all other compounds for years and years. What he's really talking about is when you have a lyophilized peptide in a vial, that is room temperature stable for a certain amount of time. The heat won't affect it as much as people think it will. So like we ship all of our peptides cold chain just to ensure that, any heat and cold isn't going to degrade them. But the real fact of the matter is once a peptide is lyophilized and it's in that little cake in the bottom of your vial, that's really for a couple of months, even up to a couple of months at room temperature is fairly stable with very, very little breakdown. The problem being with the Chinese peptides is oftentimes those peptides are just shipped here unlyophilized, and they go on a plane where it gets cold, and then they go into a UPS truck where it gets hot, and then they go, into another facility, back into another UPS truck, and it gets hot, and then they show up at a let's say an American pharmaceutical supply house where 503B pharmacies are going to be buying that and putting it into a vial for you. And the problem being with that is before lyophilization, those peptide compounds are quite unstable.
Yeah.
Once the compounds are lyophilized, they're stable for quite a long time. And actually, those vials, once they're lyophilized into the bottom of that vial, Jay from Janoshek will tell you straight up that they're good for 30 years if they're kept in the freezer, that there will be no biological activity, and that literally 30 years later, if it's kept properly at -7 or -8 degrees in a freezer, not a refrigerator, that
Yeah.
there will be zero biological activity. So yes and no, that compounds are more stable than I think people believe them to be.
Okay.
So they don't really need to be shipped cold, and
Okay.
they're 90% of the time going to be fine. Now, when you get into like really high temperatures is when you start to look at degradation in the compounds and then breaking apart. And also great fluctuations in temperature multiple times can cause a breakdown of that. So yes and no, what you're hearing, there's a lot of sort of context needed, I think, with what people are talking about, like, oh, they don't need to be cold or they don't need to be this or that or the other. I mean, the reason we put them in the fridge after reconstitution is so that they don't get bacteria, right? So
Okay.
that's the main reason we put them in the fridge, so that they'll stay viable a little bit longer. And generally speaking, a peptide is good for 4 to 6 weeks, pretty solid, with almost no degradation in the fridge once reconstituted. Now, there is a lot of back and forth on whether or not you should shake your peptides, whether they're stable once they're reconstituted or not. And there's some science showing both sides. Like some of them are stable. The smaller the chain, the smaller the amino chain in that particular peptide, the more stable it's going to be once reconstituted. But the larger the peptide chain, the worse off it's going to be with shaking and things like that. So basically, it's not that really like shaking the compounds is what's breaking apart the peptides. It's when you shake it and you get bubbles in it. Those peptide chains, they sit on the outside of those little bubbles, and then the bubbles, as they're bursting, they pull apart the chains because they are somewhat unstable. Not as unstable as people think they are, but they are somewhat unstable. Yes.
Okay. Yeah, that was a big topic debate. I haven't looked into this study, and people were not realizing we were also discussing about peptides that are not lyophilized coming from China. I don't think people really understood that that's what we were discussing,
Yeah.
and they don't understand that part. Also, with the study with Janoshek, I don't know how to say it.
Janoshek.
Was it already reconstituted, or did a study with it just not reconstituted?
I think the study was non-reconstituted. Yeah. So
Okay.
they were showing the stability of the lyophilized compounds in the vial sealed in the refrigerator and in the freezer.
Okay.
In the freezer, like he literally said, hey, 30 years later, if this is kept -7, -8, it's not moved around, it's like nothing happens to it. Literally 30 years later, it'll be the same. It's basically the same as like having stem cells in a vial that are in liquid nitrogen frozen. There's going to be zero biological activity whatsoever during that time.
Yeah. So we don't need to be careful, like, I mean, how I reconstitute as well. I mean, making sure I don't just like flush in the bacteriostatic water. I slowly add the bacteriostatic water. There's like videos on this of how to do it correctly and make sure like it doesn't degrade.
Yeah, I think it's half and half. So if you are taking your vial straight out of the freezer and it's cold, and then you've got your backwater, and your backwater is at room temp or maybe a little warm or anything like that, and you put it in and you shoot it straight down onto the peptide, it can experience what is known as cold shock, where the two compounds hitting each other, the backwater with the benzyl alcohol in it, hitting the peptide at a fast rate, being completely different temperatures,
Mm,
it can be a little bit unstable. So it's always a good idea to reconstitute your peptides. I always tell people, take them out of their freezer and just leave them on your desk for like 10 minutes. Let
yeah.
it, like, they warm up like pretty quickly to room temperature. Like within 10 minutes, it'll be room temperature. No problem. Even 5 minutes with a lot of them. You'll run into less of that cold shock.
Yeah.
And also, you'll notice with some compounds, you have to swirl them like a little bit longer to get them to actually fall into solution.
Hmm.
What we're finding a lot lately, across the industry, and I'm seeing a lot of YouTube videos about it, as well as just what we're experiencing with our own company as well. Certain compounds, or not compounds, but certain peptides seem to be more subject to precipitation and falling out of solution if they are cold and you put like warm backwater in on top of them and it's not the same temperature. Or even just if let's say your backwater is cold, some people put their backwater in the fridge. You don't need to. Backwater has benzyl alcohol in it. It's fine sitting in a drawer, a cupboard at room temperature. So some people will put it in the fridge, and both compounds will be, or both pieces of the equation will be cold, and you put cold water down on a cold compound, and it's generally, it doesn't fall into solution as easier. It'll stay chunkier for longer. So if you do let the peptide warm up, and I'm not even saying that there's a science or any study backing what I'm saying right here. This is just purely from using peptides a ton, watching this happen over, our clients and our client base as well, is if you do let them sit on the counter for 5 or 10 minutes and warm up, and then you put the backwater in, you'll have an easier time getting those to fall into solution, and they won't stay chunky as long, and you won't have to swirl them quite as long. Now, another thing is certain peptides, such as tesamorelin, there's all kinds of debate on whether you should use backwater, whether you should use sterile water for injection. It kind of a little bit depends on the manufacturer and the buffering that they've done with that peptide. So the benzyl alcohol can obviously change the pH of the peptide as well when it's falling into solution. We found that using bacteriostatic water that has sodium chloride in it is a no-no for tesamorelin. Also, a couple of other compounds. Epitalon seems to be a little touchy with that. The CJC 1295 and epamorelin, all of the growth hormone secreting peptides or secretagogues seem to have a little bit of a problem with the pH that the sodium chloride in some backwater will add. So we've started only using and only suggesting backwater with only bacteriostatic water. Now, that also being said, tesamorelin,
Without
no, with benzyl alcohol, but without the sodium chloride. So right,
Okay, okay.
yeah. Some bacteriostatic water, in fact, I've got some sitting here right now. Some of it actually comes with 0.9% benzyl alcohol and sodium chloride.
Okay, but
We've also found that the sodium chloride backwater also tends to sting a little bit more, and people don't like it as much. So we've switched to all 100% just bacteriostatic water that only has the 0.9% benzyl alcohol in it.
Interesting. Does it also matter if it's glass or plastic for the bacteriostatic water?
I can't tell you that there's any science saying that it does, and I couldn't tell you. I don't know. That's not something I've even thought about, to be honest.
Okay. I'm always curious because, the plastic thing, everyone's like, stay away from plastics. And then what if we're injecting plastics from the bacteriostatic water that's seeping? I don't know. I mean, there's a whole thing. There was like a new documentary too. I haven't watched it yet on Netflix, all about plastic. So
About plastics. Yeah, I mean, it stands to reason that if you are pulling out of something that's in plastic, there's going to be
some
minor amount of everything comes in plastic these days, right? It's like, how do you get away from it? It's so difficult. That being said, we're now doing backwater. Our 10 mils are come in glass.
Okay.
Our 30 mils currently come in plastic.
Okay.
So we're just doing like the Hospira, just the pharmaceutical grade from the 30 mils in plastic. But we're about to contract with a manufacturer here in California doing pharmaceutical backwater, and everything is going to be in glass moving forward.
Nice. Okay.
Yeah.
No more microplastics.
Yeah, as little as possible. To that end, I've actually oftentimes wondered, even like the rubber stopper
Oh, I know.
that's on the top of the backwater and the top of the peptides, and I don't know how on earth you would get around not having a rubber stopper, because how else are you going to do it? You can't open it to the air, right? But I've often wondered if there's any chance, and this just might be me being completely and totally neurotic, but every time you dip a needle in that, is the needle punching through it, or is there a chance, just a small chance, that a tiny little piece is getting like
In there. Yeah.
cut out and goes inside the tube, and then you push it into your body. I've thought about it. I don't know if there's any studies around it. I don't know if it's a real thing or if it's just me being crazy in my own mind, but I've thought about it quite often lately, actually.
Yeah, I don't know. And then I think there was someone talking about like the IV bags. I mean, you just don't know with certain chemicals. That's my theory is like certain chemicals can grab those plastics into whatever solution. So I don't know the actual chemical process, but I think maybe some substances might grab onto the plastics. Who knows? It might happen IVs too. I don't.
Yeah, that's very possible. I know that certain compounds do grab onto plastic. Like for instance, when you're talking about stem cells, they're very plastic adherent. So when we're doing stem cell therapies with people, we never put it into the bag. If we're doing an IV stem cell therapy with somebody, we never put it directly into the bag and let it drip through because a lot of the cells will stick to the side of the bag and then also the huge tubing going all the way down and you'll lose who knows how many if you're doing a 60 million stem cell therapy. I mean, are 10 million cells going to get stuck in the bag to the side of the bag and the tubing? So we do a direct push. So right into the IV catheter before we hook up the bag, we'll do a direct push of the stem cells and the exosomes just to ensure that you're going to get as many of those directly right into your bloodstream and none of them are going to stay attached in any way to the side of the bag or the tubing.
Okay, well, off subject, stem cells, but can you see the stem cells sticking to the?
No, I mean you can't see them. I mean they're tiny.
Okay.
You don't see them. They just look like water when they go into the solution. So
How do they know it sticks?
one of the reasons that we know for a fact that they stick is in particular the Muse cells. So do you know what Muse cells are?
Yeah, yeah.
Muse cells are like the 1 to 2% of mesenchymal stem cells hold these extra embryonic markers that make them more powerful. They can differentiate and proliferate more in the body, and they can actually stay in the body over time and form fibroblasts that become part of your body, not just that send out exosomes and growth factors and things, and then after a month or two you piss them out.
Okay. You're a fan of
So,
new stem cells because
oh
the
yeah. I'm a fan
stem
of new
cells
stem
are
cells.
another debate.
Yeah. But the reason we know that is the way they were actually found, the way that the Muse cells were actually found within populations of mesenchymal stem cells is that they were plastic adherent. So in petri dishes, there was this Japanese scientist who
Oh.
actually poured the wrong peptone or something into the petri dish. She poured the wrong solution in and she came back like hours later from lunch and she thought she had killed all of them and she looked at them under a microscope and realized that there was this population of cells that had like pulled themselves apart and were like adhering to the plastic.
Oh,
So of the
interesting.
petri dish. So it's literally how Muse cells were discovered.
Oh,
It's
I
how they
did
were actually
not.
discovered as a thing separate from like a regular mesenchymal stem cell population.
Oh my gosh, I did not know that. Okay. I
Yeah.
learned something new time.
And I honestly couldn't tell you if peptides stick to the plastic. I mean, it's the plastic obviously has different properties and maybe is ionized or deionized differently than maybe glass. I'm not sure. That could be something interesting to look into though, for sure.
I know. We're just trying to avoid as many toxins as possible. So
Yeah, I think in the future, as microplastics is now becoming a huge thing, like, hey, don't buy underwear with, don't
I
buy
know
clothes with,
it's
that
a
are made of
scary word.
microplastics and all of these things. It's kind of a bummer for all these companies that have been saying, hey, we make all our stuff out of recycled plastic. This is a good thing. It's good for the earth. Well, yeah, it ain't good for your balls. So,
I know. We're finding this out. So who was that? Oh, I was interviewing glyphosate girl, and she was saying how glyphosate is found in sperm, like high amounts of
oh,
in
yeah,
sperm. And I'm just like, and then she even said in tampons that glyphosate is in tampons. So then women are just is just absorbing glyphosate up there. It's just crazy. And so I mean, it sounds like we're going insane, like with all these toxins, but I mean, look at everyone's health. It's like obviously we need to do something. Like people are paying attention to these things because people are struggling with their health, you know?
absolutely. And you take a look at populations and disease, let's say 40, 50, 60 years ago, when everything wasn't wrapped in plastic, everything wasn't polyester, all
I
of our clothes were made of natural fibers, all of these things. And like many of the diseases and afflictions that humans deal with in the quote unquote modern world, I think we're finding now stem from all of these things that have become more proliferated into society.
Yeah.
It's like difficult to go out there and find clothes that aren't made of polyester,
Yeah.
that are made of natural fibers, or at least aren't 10 or 20% polyester. You know what I mean? It's like now it's becoming a thing. Now the companies are making organic cotton clothing and organic bamboo clothing and all of these things, and even going down the rabbit hole of like different clothing and made of different fibers actually holds different frequency.
Yeah.
So, and you shouldn't even mix certain ones of those frequencies with others. Like wool has a high frequency and cotton has a high frequency, but when you mix the two together, it creates like a disconnect in the frequency as well. So there's all of these crazy studies going on now. But I think what we're gonna find in the near future, going down that path, I'm talking about microplastics in clothing and housing all of our products and things like that. I think we're gonna start seeing the invention of more plastics made of plant material, so that aren't made from petroleum byproducts. So they if you are getting them into your body, they're made of organic materials, like made of corn or made of made of cellulose and like other plant derived things that would be more natural in the body with less like or zero petrochemicals involved.
Yeah, good for our planet too. I can only
Because
imagine.
plastic is all made from its byproducts of making fuel and gasoline and petrochemicals. You know what I mean? Which is also what most pharmaceuticals are made of as well. They're made of petrochemicals.
Really?
Yeah, so that if you dig back into the change in history from more homeopathic and naturopathic medicines and natural medicines to the petrochemical based pharmaceuticals, it all goes back to John D. Rockefeller.
Ah.
And he's an oil baron, and they started realizing, he had all these scientists realizing, hey, we can make all of this bullshit. They didn't think it was bullshit, but we can make all of this stuff from like different pieces of these petrochemicals. As we're taking the gasoline and refining that from the oil, there's byproducts that we can make medicines out of. We can make all this stuff. And so
Gosh.
John D. Rockefeller actually paid this man, who was a marketing genius, to basically write all of this stuff in all of these newspapers everywhere across the globe about how natural medicines are like quackery, and it's all about these new medicines coming out, because he could control all of them because they're literally all petrochemical based.
My gosh. I
Yeah,
just
there's a couple of documentaries out on it that are pretty interesting, going back to like the smear campaigns that were made about, because all medicine used to be natural. All medicines used to just come from food and were all natural plant-based
It's crazy
things.
how people have normalized medication. Like, I think the statistics of people taking a medication is like outstanding. I think it's like 60 or 70% of the US is taking one medication, and then you reach most are taking like five after 50 or 60. The
Yeah, it's
statistics are
crazy.
just insane. And I'm like, why have we normalized medication? Like, these pills just seem normalized, but when you talk about regenerative healing and tools, it's like, it just, but I think the pharmaceuticals make it so normalized, and then they're really trying to like block people talking about like healing and getting to the root cause. I mean, even my Instagram, they restricted me talking about peptides. And this is happening a lot right now. Like I'm
Yeah.
seeing every few days someone saying their account got restricted talking about peptides or stem cells. You don't hear a lot of doctors speaking on this because they're licensed. It's not just their Instagram, it's their license. So you hear most doctors are kind of like, I'm not really going to talk about this, which is awful because you have, and then you have a lot of things that can help people, but you feel like you can't really talk about it on social, and freedom of speech is you kind of are like asking questions now, like, can we talk
Yeah,
about these things?
it is insane. The medical world has created such a framework of fear around doctors and the information that they get and the
Yeah.
information that they're allowed to release. And if they say something outside of that framework, oh, boom, your license is up for, we can pull your license if you say something that we don't like. And it's kind of wild to actually think that a lot of research is not even available to be done on these things because of that main reason. Peptides, I don't care that there isn't a million or very many at all human trials on this stuff. It doesn't matter. I look at like how many millions and millions of people are using peptides, good peptides and crappy peptides, and still getting like amazing results from them. Like, I'm sorry, but massive populations of people equals a study to me. You
I
know
know.
what I mean? Like
I know. When
double
you have
random blind trials, blah, 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 this and that and the other. That doesn't really mean anything because so many things have gone through all of that. And then 5 years later, we find out, oh, that's giving everybody cancer, or oh, that causes kidney disease, or that whatever. And that was all FDA approved and went through all the trials and did all of this stuff.
I know.
I mean, just speaking about peptides, let's talk about Ozempic and Wegovy and like all the Lilly company
Oh my God.
peptides, right?
It's
Like,
crazy right now. And I feel like, okay, my whole thing is doctors are kind of like, okay, and there was the RFK, saying we were going to approve 15 peptides and everything. And now you can go to a doctor and maybe get these peptides from a compounding pharmacy. But it makes it more difficult for people to get these peptides. It makes it more expensive. And I have heard so many people tell me how they feel 20 years younger, how they feel so much better on peptides. And really, a lot of people can't afford, they barely want to do blood work. Like most people just don't spend a lot of money on this and they're trying to heal, but they don't have like all this $1,000 for one peptide, or $500
yeah,
for one peptide. So I'm like, yes, I guess it's good to have someone of this FDA governing, but at the same time, like, look at all the the medications that have side effects that hurt people that are doing all these things. And really, I don't see much about peptides of it. I guess there's this toxicity coming from random peptide companies, but I've never heard of them. Have you?
so I think what we hear on Instagram is stories about stories.
Yeah.
Like, did you realize that there was like 879,955 people died from peptides last year?
I did
Did
not
you
see
hear
that.
that?
No, no,
I'm
no.
just kidding. That was actually alcohol, not peptides,
I
right?
actually saw
So
that. Yeah.
I'm just like, it's just one of these things that you're like, if you actually take a look at what's allowed and what's FDA approved and what's out there, and then what is like tried to be squashed so hard. Like right now, the pharmaceutical industry is trying so hard to squash people from using peptides because
No.
people are getting off medications. People are getting off of all of these terrible things that cost them tons of money and actually degrade their health in one aspect that it helped in another. And I mean, down to the point of if you actually pay attention to what's going on with the FDA right now, the our lab lead is keeping a real good ear to the ground on what's happening with the whole RFK and like maybe 14 of the 19 banned peptides going back into um, being available for compounding at 503A or B pharmacy. From what I understand, about 8 or 9 of those have already been turned down by the FDA. So just because RFK said, hey, you have to do this, FDA, you have to make these available, doesn't just necessarily mean that the FDA has to do that. From my understanding, there's 14 or 15 people within the FDA that still are voting on every single one of those and deciding whether or not it's going to go back into the compound or stay on the do not compound list. And from what I understand, there's already been 8 or 9 of those that they've said, no, we're not going to put those back in. And it's
Wow.
because big pharma is paying them off to do that. They're doing the FDA is basically just an extension of big pharma, right?
Yeah, yeah,
It's
yeah. They're
it's
all, if you,
we all know that. If you haven't figured that out by this time in your life, then you have bigger problems. And
it's like BlackRock, the pharmaceuticals, and the FDA are all
it's
together.
all the same thing. It's
They all
yeah,
work in different industries and they switch. So you'll see the same people working for the FDA, then working for the pharmaceuticals, then working for BlackRock. They all just like
exactly.
all work together. They just
Yeah,
move
they're all the
around.
same people.
I know.
it's very easy to watch patterns and just take a step back from it all and just understand what's going on. And I think your audience, my audience, I think everybody has a very clear understanding that like because something is FDA approved doesn't mean anything. It just means that some pharmaceutical brand paid a couple $1 million to do a trial and most likely faked the results so they could put
Yeah.
something through and make a drug out of it,
And
patent it,
they can
and
hide
make
that.
trillions.
They can hide the information. So they can do like the whole trial and everything. And then they don't have to put all the information out to everyone.
Yeah. I
So
mean,
they,
look at the COVID vaccine, right? Like let's just take a look at that. Was that FDA approved? Were there any trials done on that? Was there any studies done on that? No, they just wanted to. I'm not even going to get into that whole can of
yeah,
worms,
well,
but they
not,
just wanted everybody to take this and they wanted to make millions and trillions and billions of dollars on this. So they just put it through without anything. There was no trials, there were no studies, there was nothing done. And now people are falling over dead and people are infertile and people are having like turbo cancers and all of these other things directly related to that. But
yeah.
the FDA said it was okay, and the pharmaceutical companies said, hey, we got to do this now, so let's do it. So the things that are held back and the things that are pushed forward, there's most definitely an agenda, and anybody with 3 brain cells can take a look at it and kind of understand that from just taking one step back, you know?
Yeah. I know. It's just like I wouldn't be where my health is today if I wasn't proactive and took action. If you're kind of in the typical person that's on with health insurance, going to a typical doctor that's getting paid, with the hospitals and everything, it's just it's a very corrupt system. Like you really can't, like I've had to be proactive in my own healthcare and doing these things. I now have true health, but it's like most people just stay in that cycle and it's just you'll never really heal. And medication is just a band-aid. Like,
Yeah, it's really sick care, not health care, right? That's what the pharmaceutical industry and the medical industry at large is in the business of sick care, not health care.
yeah,
And that's one of the amazing things about peptides is they are accessible, they're not super expensive, and
I know that's
it's allowing people to take their health into their own hands. I mean, the safety profile of by and large 5% of the peptides is extremely high. I mean, the worst most people are going to experience even from a bad peptide is going to be an injection site rash that
yeah.
might last, a day, or you might get some redness or irritation for a couple hours or a day, or you might get a little rash that goes away after a couple of hours to a day or two maximum. It's like nobody is killing over dead. Nobody's going to the
Also, I'm
emergency
like,
room.
what is
Nobody's going to the
everyone?
hospital from using peptides.
Yeah, I'm like, what are this? I have not heard of a story yet. I don't know if you hear stories all the time of people like having horrible reactions and having to go to the hospital. The only things I've heard from peptides, honestly, is actually like Ozempic or Wegovy, because I think they're injecting too much for people. You can't just give one
Yeah.
person who's 100 pounds or 200 pounds and give them the same injection per week, and you're overloading their body, and then their body goes into shock, and then they've had to go to the hospital. That's the only time I've actually heard someone saying they've had a really bad reaction is with the pharmaceutical Ozempic or Wegovy with the pen.
Yeah, with the GLPs, because they've engineered them to have such a long signaling half-life, like
Yeah,
most peptides sit in the signaling half-life window of like, let's say 20 minutes to maximum 2 hours for most of them. That's the signaling half-life. The GLPs were very specifically engineered to be a 6 to 7 day signaling half-life. So if you took too much and you went too far with it and you feel yucky and you can't eat anything and you're throwing up or you're having diarrhea or you're feeling constipated or whatever your side effect is per your physiology, that's going to last for a certain amount of time and there's not really any getting out of it, right?
yeah,
Those are when I was saying, 95% of peptides have an extremely safe um, or an extremely high safety profile. I was sort of that 5% is the GLPs because of the extended
yeah.
signaling half-life of those compounds. Now, that being said, everybody reacts differently with those. Some people can take a half a milligram of, let's say, Retitrutide, and they can't eat anything for like 4 days. Like they
Mm.
feel it intensely. Other people take 2 milligrams and they don't feel it. And so they need to, everybody's different. So if I'm working with somebody on a GLP, I always start them extremely low and titrate up very slowly just
Yeah.
to make sure that it's being tolerated and that you're doing it in a healthful manner, because you don't want somebody to get on a GLP and get sick on their first dose or their first couple doses, because then they don't want to use it again. And it sort of defeats the whole purpose of even using that as medicine, right?
Mm-hmm.
So, I mean, that being said, we had something recently. A client of mine said that one of his clients accidentally took her Retitrutide as the GHKCU. So she was injecting the Retitrutide in a very high dose every day until she used the bottle. Like
Oh my God.
she just switched them in her own mind and was just grabbing the wrong bottle every day. I mean,
These
user
are the
error,
things.
100% user error. She had her protocol in hand. She was just grabbing the wrong bottle, and just not paying
Grabbing the
attention.
wrong supplement. It's like
And so,
just
so this girl, like straight out of the gate, was doing, she basically did 10 milligrams of
oh
Retitrutide
my,
in the course of like 5 days,
oh my goodness.
right? When she should have been on like a half a milligram for the whole week. So she took
Whoa.
like more than, she basically took 20x what
Yeah.
she should have been doing out the gate. And she was okay. You know, we got her on, we got her on heavy fluids. We got her some supplements and some vitamins and minerals and things to help with what was going on. But she was, you know, she was throwing up. She was having extreme diarrhea. Aside from that, like she was okay. You know, 4 days later, she was okay. She never went to the hospital or anything like that. She regulated and got back to normal. But even that, like the safety profile of the GLPs is, I would say, much lower, just because there is a much higher risk of, I won't say overdosing, titrating too quickly with your dosing. You know what I mean?
Yeah.
Some of them you do have to be a little bit careful with, you know, like the growth hormone, the secretagogues.
Yeah.
Those can cause flushing. Those can cause, you know, like headaches and flushing and other things. Again, nothing that's going to send you to the hospital, and nothing that really lasts longer than, you know, 20 minutes to a couple hours sort of maximum. But, you know, if you did that every day and you got that, if you were taking too high of a dose every day on those daily peptides and you were having those symptoms and not getting your dose in check, it could cause some chronic problems over time.
Yeah. Do you ever hear any like bad peptides? Like they're toxic. There's components in the peptides that shouldn't be there. I haven't heard of anything. Is it heavy metals? Like what are people so
People
scared
are
of?
on about heavy metals and endotoxins.
Yeah.
And the heavy metals just come from like non-clean manufacturing process. So if the equipment that it's being made on isn't clean, it isn't pharmaceutical grade, there can be metals leaching into that.
Okay. That's where it's from.
Have I actually firsthand or even seen any videos or anything of anybody actually having heavy metal toxicity from using peptides? Absolutely not. Have I seen anybody have problems firsthand? And I mean, I've worked personally with hundreds and hundreds of people doing protocols with peptides. Honestly, other than injection site rashes from GHKCU or a couple of the like touchy peptides that, you know, 50% of the population has a difficult time with the sting or something like that from particular peptides. Even NAD plus causes people, you know, those injections cause people
Yeah,
almost
that you little
some
bump.
sting and whatnot.
Yeah.
There's ways around that. You just inject super slowly and you go a little bit at a time instead of just pushing it all in at once. That'll take care of 50% of the issues with GHK or NAD
Mhm.
injections. Just go really, really slow with it.
Yeah.
You
I've
know,
also
instead
heard
of
you
just,
can do like a little bit of KPV next to it or do a
yeah,
KPV and then do like the GHK or anything that you're sensitive right next to
yeah.
it.
So if anybody is shooting any kind of peptides, especially if you're doing multiple peptides at a time, where it could definitely cause a histamine reaction, you could get red and hot and maybe get a little rash or something. If you actually are experiencing that and you have KPV on hand, you can inject 10 units of KPV, and in 5 minutes your histamine reaction will go away. It signals very quickly and it'll take your histamine reaction away. So oftentimes I tell people, hey, if you're taking KPV, and you're taking other things, take the KPV along with those other things, and
Yeah.
it'll most of the time, like 99% of the time, it'll quell any sort of histamine reaction that you might be having with that.
Yeah.
Also, that being said, if somebody starts on a new peptide and they are getting flushed, they're taking a proper dose or maybe even less than a proper dose, and they're just sensitive to it and they are experiencing light flushing or a rash or something like that. 9 times out of 10, if people just keep going with it and experiencing that for a couple of days, 2, 3, 4, 5 days at a time on like a daily peptide, oftentimes your body adjusts to it and you stop getting those reactions.
Mm. Okay.
Yeah, that's definitely something that we've been seeing across the board in everybody that we're working with personally.
So, what do you think about the whole research peptides versus compounding for your company? And like Peptide Sciences went down, and that was one of the biggest peptide companies that's been for, I don't know how long they've
For
been in business.
12 or 14 years they've been at it. Yeah.
And they shut
I
down. I've heard that
I
they are just
think
rebranding.
I think the reason that they went down is that just like most research companies and just like all compounding pharmacies, they've been importing Chinese API forever
Hmm.
because let's face it, there are 7 or 8 maximum companies that are actually synthesizing peptides here in the US in a proper FDA registered CGMP and NSF certified facility. And most of those probably aren't even NSF certified.
Uh,
I can tell you where we make our peptides is FDA registered. It is CGMP and it goes way beyond CGMP with the NSF certification as well.
mm,
And we're very proud to offer that. Like I can personally feel good putting my stuff out there into the world knowing that it's coming from those sources. And honestly, I wouldn't be putting it into my own body if it wasn't. So the ethics of my company or my companies and everything that we're doing is, hey, if we're not going to put it into our own bodies, we're not gonna put it out there for somebody else to put it into theirs. It's the same thing with my supplement company. Near everything we do is USDA certified organic, and because we purchase USDA certified organic stuff, food,
yeah.
other supplements that we buy from other companies, that's something that I put a high value on myself. So if I'm going to do a company, I'm not just going to do that company and make it as cheap as possible and throw stuff out in the world just to make some money because something's popular.
Yeah.
Like I truly care about people getting the most out of these things and then also not getting side effects. You
Yeah.
know, not using a supplement that has heavy metals in it, or we sell a lot of ceremonial cacao,
Mm,
and we make sure that we have for Ultra Life Sport, our supplement company, we do a lot with adaptogens and nootropics, and we sell tons of bags on Amazon for some reason. We sell tons and tons of bags of ceremonial cacao, and
mm.
it's of great importance to us that we have the heavy metals reports and that they're well within
Wow.
parameters, that everything is USDA certified organic, and not only just the final product, but actually the farms and everything going back to the single origin source. That's just the kind of, I'm a nerd like that. That's just kind of stuff that I want to buy products like that for myself. So if I'm going to have a company, it's gonna reflect those same values.
Yeah, I think everyone's scrutinizing peptides, and I'm like, what about our food system? Like, it's just like the heavy metals in our food, the pesticides in our food system, like what they're putting in the grocery stores. I'm like, I don't know if it's the pharmaceuticals really pounding on, research peptides, but I'm just like, think about all the toxic chemicals they allow in our foods. Like, it's just, I
Yeah.
mean, that should be criminal.
It really should. I mean, so back to your question, asking what do I think about the difference between, let's say, pharmaceutical grade 503 pharmacy and research grade peptides. To me, they're essentially the same thing for 99% of the companies out there because most research companies like Peptide Science or Alpha Biomed or any of these other large manufacturing companies that are also white labeling and making everybody's products out there. Everybody's products are coming from somewhere. Most of them are coming from these large labs. And all those labs are doing is bringing in Chinese API, lyophilizing it and putting in vials and
Mhm.
then selling it with your label or their label or whoever's label. And I think that's why Peptide Sciences decided to close their doors, is they were coming under a lot of fire from the FDA for that. Because a lot of these companies are claiming, hey, we're a US made product. Well, I'm sorry, but bottling a product doesn't mean it's US made. Just
Yeah.
bottling it here, you know what I mean? we're proud to wear 100% USA made on all of our peptide products.
Yeah.
Because we have the chain of custody to prove that and show that all the way back to the raw sourcing of the amino acids, right, to synthesize the peptides right here in the US. And that's important to me. Now, that being said, are all Chinese peptides bad? No.
Yeah.
There's plenty of FDA registered CGMP labs in China pumping out decent peptides that have good COAs. The problem again lies in the shipping process to get those from there to here, and the hot and cold temperatures, and where it sits in a warehouse, maybe not in a fridge, maybe in a fridge, and then getting to the final source, and then the bottling of that source, where
Yeah.
things aren't tightly controlled under like one roof. There just in lies a lot of vector points where endotoxins can come in, where heavy metals can come in, like all of that stuff. So I don't think there's a difference in my mind behind a research company that is importing Chinese API and they're actually doing final real third-party testing on that, as opposed to a 503B pharmacy that's doing the same thing.
Yeah.
Like if they're testing it on HPLC and they're giving you a real true HPLC result and it's an up-to-date actual COA that's real for that product and it matches the batch code and lot number stamped on the bottom of that product and the date, and people aren't, there's a lot of companies that have been shut down recently because they were faking COAs. They get one really good batch and they get a really good COA on it, and then they're moving fast and they're just getting new batches in all the time, and they're just changing the date on the COAs. And that's a real thing, and it's happening. I mean, I'm not going to name names, but there's some big companies that have been shut down lately, namely right here in Orange County, and I think that's one of the reasons why Peptide Science actually shut down.
Wow.
I can almost assuredly guarantee you that Peptide Sciences is going to pop up next month under another name, under another LLC, and they'll be doing the exact same thing they were doing. I can
That's what I've heard.
99% sure tell you that's going to happen, because I mean those companies are doing like $1 million a day in business. They're pumping out massive amounts of peptides.
Yeah.
And there's no way that they're stopping doing what they're doing.
Yeah, that's
You know what I mean?
Yeah, that's what I've heard.
I mean, already one of the big ones that was caught faking COAs and all of that stuff shut down, and they already restarted with the same name with RX behind it. And they're just doing the same thing. Again, I'm not going to name names. I'm not here to throw anybody under the bus. This isn't a sales pitch about my peptides or anybody else's peptides. I'm just trying to shed light on what's really happening in the industry.
Yeah. It is, it's wild, wild west out there, but I feel like all functional medicine. I mean, honestly, like I was doing ozone in 2020. I bought an ozone machine, was doing rectal ozone. It's been like a guinea pig, but you know what? I'm glad I took that risk. And I think most people, and all these things have become very popular and familiar now, but it's just like, a lot of these healing modalities, you don't have 10 years of research of clinical trials or something. And it's just, there's,
but I mean, let's face it, there's never going to be clinical trials on peptides.
Yeah.
Because big pharma cannot patent them because they're naturally occurring amino chains. I mean, there's over 7,000 peptides found in the human body.
Yeah.
I mean, they're just endless, and they can't patent that. So if they can't patent it and own it and not allow others to sell it and do their own thing with it, they're not going to put millions of dollars into trials. It's unfortunate, the medical framework that has been built. I mean, it's been built for a reason so that a very few can control like a very large amount of things that go out into the population. We all know that, but it is unfortunate that that's where it stands, because there's never going to be large scale, double-blind, random tests and trials on peptides. It's not going to happen because companies can't own the patent on BPC 157. They can't own the patent on CJC 1295. They can't own the patent on, I mean, technically they can't own the patent on GLP-1 plus GIP plus glucagon receptor agonist. Like,
how
they
does
can
that work? Because I'm like, Eli Lilly's owning Retta, right?
They own Sema, they own Terza, and they own Retta. They coined those names, so you can't definitely call your compound. Anybody out there with a website selling any GLP-1, 2, or 3, as we'll call them, Sema, Terza, and Retta, any companies out there selling that, calling it even R or T or S
Oh.
or terza or reta or sema, like you truncating it, making it like, oh, people will know what it is, but we're not calling it out as actually retitrutide.
Mm.
They're gonna get popped, and many of them have already gotten popped. A lot of the big
Okay.
ones selling it, you've seen like Hims and Hers
Yeah.
got shut down for the GLPs because the Lilly company has, and more power to them. They're the ones that actually did develop those peptide chains and those compounds. They're the ones that originally developed those to be diabetes drugs and then found off-label use for them for weight loss and other things. And now you're going to find with retitrutide, if you've read through the phase 3 clinical trials, like retitrutide's doing all kinds of things. It's reversing fatty liver disease. It's having a much less effect on muscle loss and a greater effect on
Mhm.
fat oxidation and fat loss.
Mhm.
It's actually found to be anti-tumorigenic and anti-cancer in many different kinds of cancer cases. It's found to actually be reversing type 3 diabetes, which is Alzheimer's and dementia.
Mhm.
As we found in the most recent studies coming out, for years and years, we've been lied to about dementia and Alzheimer's, saying, oh, it's caused by an amyloid plaque buildup in the
Yeah.
brain, and that's the cause of it. That's not the cause of it. That's actually a side effect. So the amyloid plaque buildup in the brain is actually your body trying to fight the insulin resistance that you're experiencing.
Yeah.
So being that retitrutide is now reversing your insulin resistance and making you more insulin sensitive as you were when you were young or
Mhm.
before you started experiencing all of these metabolic breakdown symptoms, it's sort of turning back the time on that. I think retitrutide is a longevity compound.
I do
I don't I
too.
don't call it a weight loss compound. Yes, you will lose weight on it if you take it in the right amounts, but microdosed or taken in small amounts, not for generally the weight loss side effect of it. It has many other benefits down the line. You know what I mean?
Yeah.
Like I think the third or fourth or fifth benefit is, yeah, taken in the right amount, you'll be able to keep a lot of your lean muscle mass and you'll shed fat.
Yeah.
The first two, GLP-1 and 2, the studies show 50 to 70% of your weight loss could come from muscle. And
Mhm.
we don't want that. We don't want that. That's why everybody's walking around in Hollywood with Ozempic face because they've lost all their muscle structure in losing all their weight. That's when I talk to people about retitrutide, I try to tune their thinking and change their language, being not about weight loss, but being more about body composition and fat loss.
Yeah.
You know what I mean?
I took I took tirzepatide for like 2 weeks, or GLP-2. And I didn't like it because I'm all like, when I work out, I need to be strong. And I felt like I was honestly like starting to get like flabby. Like I was like, oh, I kind of like,
Like you were losing your muscle mass before you're fat. Yeah.
yeah. And then I quit because I was like, I don't like this. I don't care if I would lose weight. Like I feel like I'm losing muscle. I could tell in like 2 weeks. But with Retta, I don't feel that. Like I feel stronger, I feel healthier, and then yeah, it just cuts out a little bit of that food noise too.
It's
So I
one of the main reasons behind that is with the GLP-1 and 2, you're having less energy expenditure in the body. With
Mhm.
the reason you're losing weight is because it's just purely tied to appetite.
Yeah.
Like take a certain amount and you're not going to eat anything the whole week. Like you're barely going to eat anything. If you're not eating anything, you're not getting proper protein synthesis to keep muscle mass on, and your body is going to want to keep the fat as stores, and it's going to want to burn muscle first. It's just how our bodies work until you train them otherwise.
Yeah.
So with the GLP-3, it's actually working more on metabolic rate, and you're actually having more energy expenditure. I mean, one of the sort of negative side effects of it is that, especially in higher doses, it definitely does raise your heart rate. So
Mm.
it raises your resting heart rate and your active heart rate. But in doing so, you're also having more energy expenditure and more fat oxidation because of that. So
Mm.
it's sort of like, again, the
Oh,
safety
balancing out.
profile of these things that we talk about. Reddit, I think, is an amazing compound. I think many, many, many people can benefit from it, but it really is about dialing in your dose and getting it right for what
Your
you
body.
need to do, and not expecting to lose 10 pounds a week every week, because that's not healthy.
Yeah.
You know what I mean? Like
And I think,
slower weight loss from the right metabolic standpoint is the healthy way to do that.
and everyone wants a specific regimen. They're like, oh, how much should I take for this? Or how much should I take for this? But I think it's best to track things, like do the average. And this goes for supplements too. Like I'm always thinking, or medication. Hospital that overdosed me on iron, they gave me like 2 bags of iron. I'm like, I was, 116 pounds. And I'm like,
Oh,
it's
wow.
different than probably someone 200. And this also goes for supplements. I'm like, you should take 3 capsules. But I'm like, if it's like a, 110-pound woman versus a 220-pound guy, do they need to
Yeah,
be taking the 3 capsules both? Like, so I'm always thinking this, like, and this goes with peptides as well. Like Retta, everyone's asking what dose should I take? But I'm like, there's so many things that go into it. And I really think people should be doing the blood work. People should be wearing an Oura ring. I think like tracking my sleep has also been very helpful with peptides and like figuring out like the resting heart rate, or is this affecting my sleep? So like I think tracking with peptides is very beneficial. And I think
absolutely.
most people are not doing this. I guess the concern with a lot of people is, we're in this space, we're analyzing these things. But then you're saying, like, this other woman who just took, Retta or instead of GHK. I mean, then it goes to, is this the typical, and should we
Yeah.
be
And
concerned?
that's not typical. If somebody is getting, proper counseling or, has been written a proper protocol with these things, especially with the GLPs, I think it's super important to start people super slow and low.
Yeah, for
Like
sure.
even increasingly more and more so. Like I used to start a lot of people at 1 milligram a
Mm-hmm.
week, like out the gate. Now I've even like large guys, like let's say a 220-pound man, oftentimes I will still start him on Retta the first week at a 0.5 milligram. And I try to pound it into people's heads that like, hey, we're going to do this slow and low to begin with to make sure that it's being tolerated. And we're going to slowly get you up into the dose where you're gonna experience the weight loss benefits that you want. But meanwhile, just because you're not experiencing weight loss or severe appetite suppression doesn't mean that you're not getting all the other longevity benefits from it.
Yeah.
So just so you know, this is going to take X amount of weeks before we get you into your prime dose where yes, it's cutting your food noise. You're not reaching for food all day, but when it comes mealtime, you're actually able to eat a proper meal, get proper protein synthesis so that we can do this right. And over weeks, we'll get you to a point where, yeah, you will be maybe losing 2 or 3 pounds a week. And that's healthy. But I'm not of a mind to ever put somebody on a dose out the gate that's just going to crush their appetite to the point where they just don't want to eat anything and they're losing 6, 8, 10 pounds a week. Like it's just not healthy.
Yeah, you want to feel good on a daily basis. I don't think, if something's affecting you kind of within your day, like you feel nauseous or you're exhausted because you're not eating, like adjust the protocol. I mean, I just always think start with everything, just a little dose. And that goes with everything. I don't know why we have to go to these extremes and push ourselves, but I've always been even adding supplements in, I like to add one in at a time, because if I'm adding 10 different ones, I don't know if one's not working well with my body, how do I know which one it is?
Yeah, or if you just start with 10 things, you don't know which thing is actually making you feel rad. You know what I mean?
Yeah,
So
yeah.
I take the same approach with peptides. If I'm doing a peptide protocol with somebody and they haven't been on any peptides yet before, and we, let's say, come up with a protocol that's got, okay, maybe they're going to be on Retta and MOT and 5-amino 1-MQ, and they're also going to take CJC 1295 and maybe tesamorelin, and they're probably going to be on BPC and TB and maybe GHK because they're training and they need like workout recovery quicker. I never just slam people with like, okay, start tomorrow, do these 3 in the morning, do these 3 midday, and do these 3 at night, and just like slam somebody's body with all of those signals all at once.
Yeah.
That's how you run into flushing. That's how you run into rashes. That's how you run into like signal interference, which is the downstream, which is causing all of those things downstream, those histamine reactions, all of that stuff. We start people slow. Hey,
Yeah.
let's start you on the most benign that are going to do the best work overall the first day. The
Hmm.
first 4 or 5 days, you're only going to be on, let's say, maybe BPC and TB,
Yeah.
right? After we know that you're tolerating that, you're feeling good with it. You might even be noticing that you feel a little bit stronger and more recovered at the gym after, 2, 3, 4 days on this. Then and only then we'll start to pepper in the next peptide set. So then maybe we'll pepper in the secretagogues. And I generally don't start people out the gate on a stack of those. I'll start with one or the other and make sure it's tolerated for, again, 3 to 5 days before you start stacking things on top of each other. And like maybe over the course of 2 or 3 weeks, we build somebody up to the point where, yeah, maybe now you're taking 6 peptides every day,
Yeah.
but not out the gate day one. It's just plenty of people do it and have no problem with it. But again, with these things, not everybody has the same physiology. Not everybody's dealing with the same
Mm,
core issues in their bodies. So it really is, when we talk about safety profiles with these things, it is about, like you said, people should be pulling blood work. People should know kind of like where they're at when they're starting out, so that number one, like if you're on a bunch of set of peptides and you're maybe not feeling it a month later, and you're maybe saying, hey, I'm kind of like discouraged because I thought I was going to feel all this amazing stuff from these peptides, I say it's better to do blood work in the beginning. And then a month or two later, when you've been on like a peptide regimen, pull blood work again. And let's look at your
yeah.
panels and see what's changed,
Yeah.
because so many times, well, literally every single time, I've never had somebody pull blood work a month later after being on a peptide regimen and not seen massive changes in like levels of markers across the board.
Yeah, it's so important. I think everyone also just wants the peptides as the one solution. And I'm just like, no, you have to lay the foundations of health. You have to like, this isn't just like a band-aid. This is regenerative. But if you want true health, it's like you can't just use this, as your
Yeah.
little one-stop shop. It's like you got to be doing the other things and checking deficiencies and checking for toxins and eating real food and all those things that go into health. Everyone just wants
Yeah.
one fix. And I'm like, it is great. And you can bring in peptides with other things, but it's like it's not gonna fix everything if you have
They're not a magic bullet without other things. Yeah. I
yeah,
like to use the connotation that like true health and wellness is always based on a multi-pronged approach.
yeah,
Right? You're using a fork, not a spoon. You're
yeah.
using a rake with lots of tines, and each one of those tines is a different thing, from supplements to peptides to food to water to sleep to
Mm,
exercise, training. It all of those things together absolutely are going to get anybody healthy.
yeah,
Looking at even two or three of those things, not even all of them, you know what I mean? So
yeah.
where we see the most results with people is when they're actually training at the gym, when they're getting proper exercise, when
Mm-hmm.
they are ensuring that they're still getting proper protein synthesis.
Mm-hmm.
Even if you're not on Reta and you're not trying for weight loss, but even when where you're using, like, let's say the secretagogues to try to burn a little bit of visceral fat and gain lean muscle mass, it nutrition still goes a long way to making those things super highly more efficient, and you're going to get like 3x better results if you're looking at two things instead of just the one, right?
Yeah, and it's also like there's inflammation if you're constantly putting things in your body that's causing inflammation, and then you're trying to take a peptide to reduce the inflammation. It's like, it,
Yeah.
it can only do so much.
Like, I'm gonna shoot all my peptides, then I'm gonna go out and get drunk at the bar tonight, and it's just
Yeah, I
like,
need some
ay, ay, ay,
Doritos,
what are you
or
doing?
something.
Yeah, right.
So tell us about your nasal sprays. We did want to discuss this and we haven't
Yeah.
really got
So
there.
one of the major things that we're really excited about, besides the fact that we're doing completely American-made peptides from synthesis on forward, is our nasal spray technology. And like I mentioned earlier in the conversation, one of the whole reasons why our lab started to do peptides was because they were developing this Protix Ion
Mm,
technology. And there's other nasal sprays out on the market, and you won't see very many companies offering like a wide array of nasal sprays. You've kind of only seen like the smaller peptide chains like Samac, Salonc, DSIP, like a
mhm,
couple of the smaller chain peptides that are small enough to cross the nasal barrier.
uh-huh.
You've only seen those really offered. You see a lot of BPC TB, those are fairly small chains as well. But beyond that, you don't see a lot of different peptides being offered. And the reason is because most of the peptide chains are too big to cross that barrier,
Mm,
because the intranasal epithelial layer membranes are like really, really tight. You could think of it, they're not like this, they're like this, right?
mhm.
And they're that way for a reason, so that we're not just breathing in a bunch of pathogens and a bunch of stuff gets in our nose and nasal cavity and gets uptaken there and we get sick and die. So what our Protix Ion technology has done is it's created a lipophilic encapsulation at a very, very small nanometer size. So most other nanolipid encapsulations, well, all others on the market that are doing a nasal spray are nanolipid encapsulating at, let's say, 14 to 20 nanometers or higher, right? And they're doing it with bombardment. So that's the way normally things are lipophilically or let's say lipolyzed or encapsulated in a lipophilic compound, right? So the problem lies two things. It's still too big of a molecule to really get much past that membrane. Number one. Number two, the process by which that encapsulation is happening from most other companies, or let's say all other companies on the market that aren't using our technology, is they're using bombardment or sonication or other methods to create those molecules into that nanolipid encapsulation, right? And in bombarding those molecules, we know that peptides are especially subject to breaking apart under, let's say, that bombardment that happens, right? So not all of those peptide chains are surviving that bombardment to get lipolyzed. So what our company is doing with our patented technology is we're using an ionic process to actually be able to nanolipid encapsulate at 5 to 8 nanometers. It's 5 to 10, but most of them, like under the flow cytometer, we're able to look and see, and the nanolipid encapsulation size is between 5 and 8 on most of them. It does go up to 10, but I think something like 70 or 80% of them are between 5 and 8 nanometers. So what that's actually doing is it's allowing, the ionic process is actually allowing for those to be done without sonication, without bombardment. So all of the peptide chains are staying stable and being nano-encapsulated at that super small rate, which just allows them to pass that barrier more. And then also, as part of it, there's a part of the solution that actually opens those epithelial layer membrane weave, like on contact, like it loosens that weave. And between that weave loosening and the 5 to 8 nanometers, it's allowing a greater cation exchange across that epithelial layer membrane. So it actually works on your skin too. That's an epithelial layer membrane. It works orally, mucosally quite well also.
Interesting.
So where other nasal sprays on the market have been sort of in the past working at, let's say, 20 to 25%, if you're lucky, the efficacy of an injectable, what we're putting out there now, and we just published a 50-page dossier from a 4-month animal trial that we did, showing the absorption rate and proving all of these data points. And it actually came out like, the guys from the lab kept calling me like super excited about like what was happening, what the results they were getting back from this third-party animal trial that we did for 4 months. And it's showing that our absorption rate is about 75 to 85%, depending on the peptide, that of an injectable product. So we're still not 100% there yet. It's not working 100% as well as an injectable, but for somebody who is very needle averse and wants to experience peptides and wants to kind of get into the peptide space and do peptide therapies, but they just really do not want to poke themselves with needles all day, it's an awesome alternative. And also for somebody like me who I'm on all the juice, like I'm on, like, let's say,
Poking yourself 10 times a
I
day.
mean, I'm on a low dose of Retitrutide, and I cycle thymosin alpha 1. It really helps me with my rheumatoid arthritis. So I'm like a month on, month off, month on, month off, thymosin alpha 1. I take Samax and Salunk, 3 to 5 days a week. I take Dihexa probably 3 to 5 days a week. I take 5-amino-1-MQ. I take MOTS and SS31 back and forth. I cycle on and off CJC, 1295, epimorelin, tesamorelin. I'm also on kisspeptin 3 times a week for testosterone boosting and hormone balancing. I take BPC TB 5 days on, 2 days off. That really helps me with my rheumatoid arthritis. Between that and the thymosin alpha 1, I literally for a year have not experienced a joint ache or pain or swelling, or I haven't had literally one single bit of RA symptoms, like at all, like none. Which I will never go off of those because they literally I don't have symptoms. I don't even consider myself to have RA anymore at this point.
Wow. I know
Like,
that's so crazy. And people are like, "Oh, when do you stop taking peptides?" And I asked like Dr. Jonathan Cole, I was like, but he's like, like you get to a certain age, or if you have some type of situation like yours, like why? People are taking medications their whole life. Why not take something that's not having side effects and causing you to be on more medication?
yeah.
It's like,
I mean, essentially, when you're taking peptides, you're just turning on and off signals in the body that already exist.
yeah.
You're not taking a drug that binds and works on some binding affinity to some receptor to cause something.
Mm-hmm.
All you're doing is creating signals that already exist. You're just turning signals up or down. You're literally bioregulating is what you're doing. It's all you're not changing your biology with something exogenous. You're literally just you're tuning up and down your own biology to where it should be functioning without all the modern day bull crap that we have to deal with
Yeah.
in the world. That's why I love peptides so much. Is they're not drugs. They don't work like drugs. They're literally signals that already exist in the body.
Yeah.
Back to the nasal sprays. Like for somebody like me, who I'm on all the juice, right? Like I'm on
Yeah.
like 11 cans of juice like weekly,
I mean, you do
and
own a peptide company, so it makes sense.
so, doing the nasal sprays for at least half of them or more is awesome for me because I don't have to poke myself so much.
Okay.
Also, the nasal sprays really hit fast and hard.
Mm,
So, there's some of them that I truly believe work better. The peptides that you get an overt reaction from very quickly, like let's say Samax and Salonk. Those work better, in my opinion, as a nasal spray because if you take those as an injectable, it's going to be hours, maybe even 5 to 7 hours before it slowly onsets and signals. But when you take Samax and Salonk, I know you've experienced the Samax and Salonk,
yeah.
when you take those, it literally hits you in like 20, 30 minutes. It's an overt feeling. You feel it working. The delta sleep inducing peptide is the same. The sexual health and libido peptides like PT141 and oxytocin, same thing. It hits. You're feeling the effects. You're experiencing it within like 30 minutes.
Yeah.
So whereas the injectable of PT141, it's sort of like, yeah, you inject it now and you feel it 5, 6 hours, 7 hours later. So um
Yeah, that's
I
probably
really
the nasal
love
spray instead.
also to that end, for me, I cannot stand injecting GHKCU. I can't stand the copper
Yeah, a lot
peptide.
of people
It
struggle.
drives me nuts. It hurts really bad some days. It itches really bad some days. Sometimes it just sits there in a ball and won't dissipate for sometimes up to 2 days. I get like really bad bruising. It's just my body does not like injecting GHK. It just doesn't. But I love the nasal sprays. I
Mm,
love our GHK KPV nasal spray. It's awesome. It doesn't burn at all. Like I take the GHK as the nasal spray like 5 days on, 2 days off, and I don't. It's super comfortable to take. I don't experience any of the injection site redness or itchiness, or it doesn't hurt for days on end. So for somebody like me, I still do inject many of the peptides. I
yeah.
do, but I would say that I'm on like probably 50 to 60% of them as nasal sprays now, and I'm finding the same results pretty much across the board with the nasal sprays.
And
Yeah.
now I have so many ideas. I'm like, okay, so with this technology, this ion technology, I'm like, okay, patches and also skincare. Like, I mean, if
Yeah.
it does absorb better in the skin,
So
okay, please make all the good peptide skin.
as you mentioned that, I will say that our lab is currently our lab lead, the head scientist at our lab, has worked in skincare for like 20 years. His mother is huge in skincare and manufacturing. She's very well known in the industry. So he's worked alongside her as a scientist in skincare for 20 years plus. They're now working in our lab on lots of other things, incorporating the Protix Ion technology for better transdermal absorption. That being said, also, I have a secret, which I'm going to let out right now, is we're actually working on incorporating that into breast strips. So for oral mucosal delivery.
Oh
And
my,
oral mucosal breast strips work like okay. I think they like other companies, they work, I would say, like maybe 30 or 40% as well as an injectable.
mhm.
That like a lot of companies are finding pretty good inroads with that. I just got some test strips, breast strips the other day, and I got one that was PT141, oxytocin, and aminotadalafil. So
Oh,
this is one for the men and the women for, sexual health and libido and, creating desire and also, pumping the old, whatever. So I will say that we just got the first tests back from the lab. We also got some BPC TB, and they're working on a couple of other ones that we're going to start just doing testing on, just to see what kind of efficacy we can get with that. And adding the Protix Ion technology into those, I will say, is pretty awesome, because I took the PT141 oxytocin aminotadalafil the other day, and literally 10 minutes later, it was on.
you could tell you're like, it does
Yeah.
work.
And I also gave it to two other male friends of mine, and they reported back the same thing. Hey, yeah, like 10, 15 minutes later, I noticed it definitely, like it was on.
Wow. Okay. Let
So
me be the guinea pig for these test breath strips.
yeah, as soon as I get more, I'll actually send you some out,
Oh
and
my
you can
gosh.
try some of those things. In fact, I want to send you some other nasal sprays and a couple of other things to check out that we have coming. We have a whole list of new stuff coming as nasals and injectables in the next 2.5 weeks. Everything is like finishing up now in the lab. We just have to send out for the third-party testing now before we release it.
Oh my
We've
God.
got 5-amino-1-MQ coming as nasal. We've got AOD 9604, ARA 290. We've got a glutathione 2000 milligram. We've got a methyl B. We've got kisspeptin coming as a nasal. We've got there's 4 or 5 other ones that
Oh
escape my
my
memory right now.
gosh.
And we're going to be working on all of that stuff to see how oral mucosal delivery works with the Protix Ion and those breast strips as well. So I'll definitely keep you up to date and send you some
Oh
care
my
packages.
God. I'm
Actually, check
curious.
this out. Like, you're a giraffe, right? You're a grateful giraffe.
Yeah.
Yeah. So check it out. We're doing the biohacking safari in LA this
Oh,
weekend. Are you coming out to that?
they asked me to speak, but I was like, oh, now I'm just I do miss that whole everyone I know in LA is going and speaking, and I'm so sad.
Yeah, so I'm one of the panelists on the peptide panel, and we're
Oh,
also we have a Ultra Life Peptides. My company is going to have a booth there, and so we're actually doing a little limited edition here. I'm gonna do a
my
secret drop. So we're doing the necktides.
Oh
So
my God.
stretch your life necktides. So we're doing a little Grateful
I'm
Giraffes
so
Ultra Life Peptides
stoked.
collab here.
I
So
love it. Does
just
it
one
say
product for
grateful
now.
on
We're
there?
just doing
Gratefulness.
this in the Samac Salon for now. It's just like a limited edition for the show on Saturday, but it's just
So
a fun
cute.
little collab we're doing.
My gosh, you're gonna have to tell everyone hello, Max, hello, everyone. Oh my gosh. So, so sad. You were at the Biohackers World too, I
Yeah,
guess.
we were just there, what, two weekends ago? It was
Okay.
insane. It was
I had two people
absolutely
that are like, I
insane.
just
It
bought a
was
ton of peptides from Ultra Life.
Yeah, we had our booth was nuts. I think people there realizing that we are the only actual real American made peptide company there. And then
Yeah.
also the nasal spray technology is really starting to take off. I had people buying peptide sprays the first day and then coming back and loading up and buying like tons more the second day, because they were like, yeah, I got the Samaxalonc, I got the DSIP, I was up and like I really felt on all day yesterday with the Samaxalonc, and then last night I slept amazingly with the DSIP, or like, people were trying them literally that day and then coming back the next day and just like loading up. Our booth was mobbed with people from literally like before it opened, like 8:30 a.m. until like we didn't get out of there until like after 9 every night. And they were like, shut the lights to half at like 6 p.m. and there's still like 20 people waiting at our booth to try to buy stuff and hear about the technology and stuff. So it was awesome. I completely lost my voice for like 3 days
Oh
after the
my
event because it was just like nonstop. But the energy was awesome. I love those events because it's our people.
I know. It's
It's
like a
our
whole
people, you know?
reunion. Like the biohack
Yeah.
safari, that will be like a whole reunion of people. I think like Dr. Joy and everyone's gonna be there. It's just always
Yeah,
like
we know Joy really well as well. Yeah,
she's the
we've
best.
worked with her and our stem cell company like a lot for the last few years.
Yeah, she's been on my podcast twice. I just love her. She's the sweetest.
Yeah, she's
She's so
awesome.
passionate about stem cells and like for a good reason.
And she's getting more heavily into peptides as well.
Nice.
We actually, one of the nights on Saturday night, or was it Sunday night? It was Saturday and Sunday. Sunday night, we were in a long, deep discussion with her, like after the show closed, like we were still sitting there on the floor, like packing up and like in a deep discussion with her
She's yeah,
about peptide
she's
science.
so great. Quick question too. Have you tried do you guys have the KPV nasal spray?
We do, yeah.
Have you tried that on your skin? Because I know you were saying you were using that on some like
Yes. And
rashes.
so I mean, you don't have a before and after, but you can see how clear. I mean, I have a lot of
Yeah,
freckles, but I
I
just am
think you
freckly.
showed last time.
Yeah, so I was experiencing every once in a while I get these like psoriasis flare-ups
Huh?
from just stress and whatever else. And so I had flown to Utah. It was super dry in the winter there. I was staying in a hotel and it was air conditioning and like the air was really dry and I was like stressed out for a weekend. And I kind of had this really bad flare-up of psoriasis. I mean, I had like, big patches like all over my arms and hands. And I was taking the KPV and I didn't know if this was going to work or not. I just had a theory. I was just like, I'm going to try it. It can't hurt. So I was literally taking the nasal spray and like spraying the KPV GHK spray like
Oh
directly
my
onto my and just like kind
God.
of patting it in and let it dry and like soak in on my arms. And I gotta say that literally after not doing it for 2 weeks, and it like my psoriasis not really getting much better with the cortisone creams and else. I started doing that, and then I was also doing the GHK KPV spray intranasally. I gotta say, literally over the course of 3 or 4 days, it halved. And
Wow.
over the course of the next week, it literally, I mean, I've got nothing. That's just a big freckle. But like if you and I had it on the bottoms too, you can see it better on the bottoms. But like my skin is completely clear.
Oh my
Like I
God.
don't have any real psoriasis. There's like tiny little like a dot of a red patch left here and there. But like over the course of 2 weeks, and normally my psoriasis would take like a month to 2 months to go
And
away.
like heavy medication or something.
Heavy medication, antibiotics, like the cortisone creams and all that be, which also comes with
Wow.
its own inherent base of problems, using that kind of stuff too much. So
I didn't,
yeah,
you said the KPV, but for some reason I was thinking just the regular injections, but then I was like, wait, the ion like nasal spray would be better for it. So
yeah,
like,
yeah. It's like I can attest firsthand, literally firsthand, no pun intended, that it works very, very well. Very well.
oh my gosh, that is so cool. So many people should try that and like be a little research guinea pig because I mean, if it's, calming down inflammation on the skin, that's huge. Like so many people deal now with psoriasis and all these skin issues.
Yeah, 100%. I'm really excited that the lab is now actually formulating some skincare
Yeah.
products, not only just using GHKCU because that's everywhere in the skincare industry
Yeah.
now. It's like everybody's onto that. Like, but KPV also has huge benefits as well. So
Yeah.
it's working directly on your largest inflammatory cytokine pathway, the NF-kappa B pathway.
But this would be different with the ion technology because it's going to be able to
It'll be
absorb it better.
Yeah, it'll be more transdermally absorptive, correct?
Yeah.
Yeah.
Oh my gosh. I'm so you say skin and everyone will like be loving it. Like everyone just
Yeah,
wants to look youthful like
it's
on the
our it's a
outside.
besides just looks maxing, right? It's
Yeah.
also like it's our largest organ. We need to take care of it, It's like it's where our aging tends to show the most, you know what I mean? We're visual
Yeah.
beings and like everybody wants to keep, their skin tight and clear with no wrinkles as long as they possibly can.
Yeah. I don't
Because
know if you have a shower
it's
filter.
an outward visible sign of how your body is aging internally as well.
Yeah, I didn't think about this, but I don't know if you have a shower filter, but like if you don't, it's like you're putting chlorine all over your skin when you're showering, and it really disrupts the skin microbiome.
Yeah,
And it
absolutely.
really, you don't have like the good bacteria kind of can destroy some of that. So then you have other skin issues. All these things that we have in our water and food system now and stuff, it's like we gotta stay on guard.
Yeah, we have a Kangen water machine.
Okay, okay.
And so we do the hydrogen water, but we also, when we built our new house a couple of years ago, we cut the water main, and in between the water main and any water coming into the house, even like the outside spigots that water our plants, goes through a fluoride filter that's like as tall as me. It goes through another whole home filter and then 3 other filters and a UV filter and reverse osmosis before it goes to any spigot in the house, even like, what we feed our animals,
Wait, which
what
one
we
is this?
we use I think it's called Crystal Quest or
Okay.
So I think it's called Crystal Quest.
Okay. Oh my
It
God.
wasn't cheap. I think it was like 16 or 18,000 bucks or something, but
Yeah.
we were remodeling the whole house.
Yeah.
And I'm like, well, everything is torn up and we're remodeling everything. Let's do this before we move in and like ensure, like, I mean, that's more important to me than having cool furniture or like,
For 1,000.
extremely nicely troweled walls or whatever. You know what I mean? Like
Yeah.
your water is very important. Before that, we actually had a Kangen filter. Like
Okay.
Kangen actually sells a water filter for
Mm,
it's called the Anespa, I think,
okay.
that screws onto your shower spigot. And I definitely noticed when we bought one of those, literally the very first day I used it, like first time using it, I noticed that my skin felt different and I noticed that my hair felt different. My hair was softer and my hair almost, it was like softer and felt like I had like conditioned my hair. And I don't really generally use conditioner on my hair. I use shampoo, but I don't use conditioner.
Mm,
And yeah, I definitely noticed my skin felt less dry. It felt more supple, like literally first day using it. It's
yeah.
crazy how much water affects you.
I know people don't think about this and they're just using a Brita or not even a filter. And I'm like, it's shocking how people still don't filter their water. It's probably one of
Yeah.
the most important things you could do for your health. Like,
Yeah, we're building a swimming pool pretty soon in our backyard.
mm,
And we're going to build it, and it's going to be like a saline pool. So it's going to be a
uh,
saltwater pool with no
yeah,
chlorine. And
yeah,
also, it'll have all of that filtered water that goes into it because like I said, we cut the main, and in between the main and anything coming in or out of the house is now going through that filter.
nice. Yeah, I'm always worried about pools. Like I was just listening to Joe Rogan and they were looking up, they're like, does Michael Phelps have like, like why are they not doing studies on this? Like people who are swimming in chlorinated pools all the time. Like
Oh,
are
yeah, their
they like
skin's got to be thrashed.
yeah, I'm just like, if you, once in a while, I guess, but I think it disrupts the whole skin microbiome. But I kind of, and then there's also the cold plunges that use chlorine too. A lot of,
Yeah.
I don't do those anymore. There's ozonated cold plunges.
Oh, yeah. Actually, there's a company, not to go off on a tangent, but there was a company that we met with that's here in Irvine, actually, and they're doing like this oxygenated water bath,
Uh,
and they're actually using like extremely filtered water with that's like remineralized as well, and then they actually ozonate the water.
mm,
And
yeah.
it's supposed to be amazing. We're supposed to go experience it actually
Oh,
pretty soon. I think next week, Alba and I are going to both go experience that.
oh my
We're
God.
excited for that. It's supposed to be amazing for your health.
Yeah, I love ozone. I think it's a great, and everyone's doing the EBU and all that. It's like super healing for people.
Just just did one 2 weeks ago.
Oh, really?
Yeah, I had a super crazy body spa day where I went in and I did an EBU treatment, and then uh, I did how many? I think it was 300 billion Muse exosomes. And
Oh,
then I did 60 million Muse stem cell push
oh my,
behind that. And then I did a vitamin bag with like everything, Myers cocktail, everything, vitamin C, all the good stuff, all the B vitamins, and then also NAD plus. And then I did a glutathione push after that. So I was like, I'll tell you, I've been feeling really amazing for the past couple of weeks. Like I've felt really tuned up.
can you say where you did this or no? Is it
So we used our Muse exosomes and stem cells and
okay?
our NAD plus. Uh,
Okay.
but I did it at a place called, in fact, we just white labeled for them. They sell a lot of our peptides.
Okay.
We just finished a huge order for them. It's called, dang, I literally just
I need
finished
to
this.
go.
So I should
I
know what
want
it's
to
called.
feel
One second.
superhuman.
It is called integrative. It's called,
Okay.
yeah. It's my buddy Anthony. I've known him for years. Him and his mom. His mom's like a naturopathic doctor. And they have this clinic and they do EBU, they do stem cells, They do all kinds of really good treatments. Like
Oh
I
my,
was getting like red light on my neck and my back and my head and like my
everything you
arms and
do,
my
and then they're just
legs. Like,
pumping stem
yeah, it was
cells in
just like
one
I
arm.
was there for like 4 hours for all of this, right? Like with the NAD and the drips, I have to go really slow with it. I'm very
Oh,
sensitive to it. Like
mm.
I shoot 50 milligrams of NAD every day.
Oh wow. You're
Well,
still.
actually every other day. I do the nasal sprays every other day, and then on the off days I do an injection of 50 milligrams.
Mm.
But when I do like a larger amount of NAD, like I think I did, what did we put? I think we put 200 milligrams in all of our bags, 175 or 200 milligrams,
Hmm.
and going direct into the vein. I have to keep backing it off and going slow and slow
Oh wow.
because have you ever had an NAD drip? Have
Take
you
it really.
experienced that sort of like pressure and that anxiety feeling? Like,
I have once and different situation, but all the other times, like I can take it in less than 30 minutes, like 500
oh
milligrams.
wow, wow.
Yeah.
I guess I'm one of the ones that's really sensitive to it. I kept having to slow it down, and I was feeling all like woozy and like pressure and stuff,
Oh
and
my
I'd
God.
back it off, and then it was just like, yeah, now I feel fine, now I'm okay.
Have you done an RIV?
I
Nicotine?
haven't, but I've heard that's way easier to do.
Yeah, yeah,
I've
yeah.
heard that's way easier to do, and actually, he offers NR there,
Mm.
and I should have done that, but I was like, no, I've got a vial of NAD, I'll just bring our vial and do our NAD, like.
Okay, you gotta check out the NRIV. You gotta do that.
Next time, so I'm gonna go do another one of those treatments in like another month or two. And when I go back, I'm gonna do the NR in the drip instead of the NAD plus. Yeah,
It's
I've
weird.
heard it's way easier to handle in your body.
Yeah, and you'll feel it like in your jaw or like in your it's completely different. It's like
Yeah,
the whole feeling. It's kind of strange. I don't know.
yeah. It's
But
essentially giving you the same thing anyway, right? It's the precursor to
yeah.
NAD. So,
Yeah, yeah, yeah. So, anyways, quick question. What is your necklace before we go?
oh, my necklace. So this is pretty rad, right? I get comments on this all the time. So this is made by Third Eye Pine Cone.
Okay.
So if you ever go to any music festivals, you'll see them. They're always there. So
Um,
it's actually made on like it's like a cross section of the world's densest pine cone. So
that's
you can kind
super
of see the
cool. Yeah,
internal
yeah,
piece of the
yeah.
pine cone. And then it's got like crushed crystals, different crystals in different colors for like all the chakras. And it's got this really
Oh,
nice big piece of labradorite.
okay.
Yeah, I every year at Lightning in a Bottle, I buy one of these like power pieces from them. It's sort of like to commemorate the festival every year.
Super cool.
And this was the one I bought the first year, and I don't know if it's just because it's blue and blue's my color and whatever, but I feel naked when I don't wear this. Like I have 5 of these, like these power pieces with like all of these big stones on it as well.
Mm-hmm.
And I wear this particular one. I wear almost every day of my life. Like
Oh
I
my
don't like taking it off. I feel kind of naked without it. And I never wear any of the other ones. Like very rarely do I pick up one of the other ones and wear it.
That's how I feel about my Aura
Yeah,
Ring.
shout out to Third Eye Pinecone. They make awesome pieces,
Oh
like
my gosh.
super powerful pieces.
I was like, is that some EMF blocker? I didn't know.
It essentially is with all the stones that are in there and all the crushed crystals, yeah.
Super cool. Well, enjoy biohacking safari. I might have to hop on a flight and go.
Yeah, come on out. Come on out. If you need a place to stay, you're welcome to stay with us.
I'll stay at the warehouse.
Stay at the warehouse. We'll pull you up a cot in the warehouse, right?
Anyways, but yeah, thank you so much for coming on. This was so great. I'm always learning and everyone keeps learning. And I'm really grateful to have you on and give knowledge of what's really happening in the peptide space because there's just so much on social media and it gets very confusing. So really, really
It
appreciate
does. And I think that there's a lot of, like we said, there's a lot of misinformation out there. I don't think people mean to be putting out misinformation or anything like that. I think it's just a matter of there's just so much information floating around and there's so many people jumping into the space and being experts in the space or whatever. And I don't claim to be any, world's authority on this stuff, but I do work in deeply entrenched in the peptide space from, not only my own company, but I'm working directly with the lab and other labs, testing labs. Like I'm as entrenched in the peptide space as one could be.
Yeah.
So I'm doing my best to try to as things change, as we learn new information, better dosing, different ways of using things and stacking them, because it's still an emerging space, you know. So it's all about being open to the change that's happening and new information coming, and just trying to stay ahead of it all.
I know it's going fast, but it's helping. So
Yeah.
thank you so much for coming on. I really appreciate it.
All right. Thank you.